Nicotine is obtained from the tobacco plant Nicotiana and is a highly addictive compound. Tobacco is known to be consumed in various forms for a long time, but most popular form became when it was introduced as cigarettes in the late 50s. It's also used in cigars, in snuffs, some amount in e-cigarettes or vape, and is also available in chewable form. I'm from India, and people have been smoking tobacco wrapped in leaves from a plant called tendu leaves for many years, and I guess it was way before cigarettes were started in USA. The tobacco plant, it contains nicotine, which is very addictive. But besides that, there are over 7,000 chemicals in cigarettes, which damage the human health in multiple ways. Once burnt, cigarette has toxic substances like carbon monoxide, lead, acetone, arsenic, ammonia, hydrogen cyanide, etc., which are not only carcinogenic but toxic for consumption by humans. Now let's see how tobacco is used worldwide and in Canada. Now, according to WHO, in the year 2020, worldwide about 22% of world population, which is about 1.2 billion people, they smoke tobacco. And if we talk about the death which happened due to tobacco use, it's over 8 million every year, out of which 7 million are direct users, and about 1 million are the passive smokers, or the second hand users. Now, tobacco smoking or the nicotine addiction is one of the leading causes of preventable deaths in the world. Why preventable? Because if people quit smoking, yeah, they can prevent the death. If we talk about Canada, in the age a 15 years and older, about 12% people smoke tobacco, out of which 11% male and 8% female, they smoke every day. 6% Canadians use vape or e-cigarettes, out of which 25 years and over, they are using vape to either reduce. 40% of vape users are vaping either to reduce or to quit, or to avoid returning to the cigarette smoking. The most cigarette is consumed in Canada in the age group of 50 to 64 years, which is around 16% people. Now, if we take a look at the worldwide consumption of tobacco or the cigarettes, this is France, Jordan, and Indonesia. They're the people, like more than 30% of the population is smoking tobacco. And we have Oman and India, which is very low on the scale, which is around like 7%. Here we will try to understand how nicotine affects the brain. As nicotine enters the lungs with the puff, it eventually enters the blood and reaches the brain within 10 seconds, and it activates various brain areas. The nicotine, it stimulates the adrenal glands, which release adrenaline, and adrenaline that helps in reducing the stress levels. Nicotine also triggers the release of dopamine in the reward system of the brain, thus giving the feeling of pleasure. This reward system creates a memory circuit, and as the nicotine level decreases, sometimes after smoking, the dopamine levels also decrease, and the memory circuit then reminds the brain about the pleasure that it received by the use of cigarettes or the nicotine, thus craving it for the repeated consumption. Now, this repeated use of nicotine eventually leads to the addiction. While nicotine affects the brain for addiction and craving, it has some very damaging effects on the human bodies. The nicotine smoke or the other chemicals, when they enter the human body, first of all, they damage the lung nerves, the nerves which are connected to the lungs and with the central nervous system. They starts to get damaged, and then when it enters the lungs, it also damages the alveoli and the bronchioles, which leads to different health problems like bronchitis, asthma, and chronic obstructive pulmonary diseases, or COPD. When the nicotine enters the blood, and it then starts affecting the cardiovascular system, First of all, it replaces the oxygen in the blood by carbon monoxide, thus reducing the oxygen level in the body, which leads to tiredness or the kind of lethargic feeling once you stop that. And it also constricts the blood vessels, which ultimately results in the blockage, leading to the cardiovascular problems or the heart problems. The nicotine, this also affects the immune system, and it weakens the immune system, thus making the human bodies more susceptible to infections. This also damages the mucus lining in digestive system, leading to various gastrointestinal issues like acid reflux or ulcers. When somebody smokes a cigarette and the smoke, it enters the mouth and the nose, and you're releasing the smoke from nose, this starts to affect the nerves which are present in the nose, and they starts to damage the taste buds in the mouth. If we talk about the smoke which remains in the mouth for some time, it creates the cavities in teeth and leads to yellowing of teeth. I've seen many people who lost their teeth because of excessive smoking. The nicotine, it depletes the calcium level in the bones, and it weakens the skeletal system. It even leads to diabetes, or the abnormal blood sugar levels, which ultimately damages the kidneys as well. um the smoke, it affects the vision in very rare cases, but definitely many cases have been seen to have lost the vision, leading to the blindness. And it affects the reproductive system. It leads to erectile dysfunction in male, and in females they are not able to they cannot get pregnant, and they lose on their chances of having a baby in life. After we've seen the kind of damages the nicotine does to the brain and the human body, let's find out about if somebody tries to stop smoking, or when people don't smoke, what are the withdrawal symptoms with which either they which leads them to have smoke again, or if they are trying to quit smoking, what are the symptoms they have to face. So these withdrawal symptoms, they include cravings, the anxiety, stress, depression. They affect your appetite, so you can have constipation, dehydration. Mainly you have, it begins with the headaches, and then you have insomnia, like you have very difficulty in sleeping. It affects your concentration, because of the mucus which comes into the lungs. This leads to coughing, a lot of coughing, and irritability. The anger comes, and the heart rate is affected. It leads to fatigue, it leads to restlessness, it leads to tremors or shaking of hands, or having goosebumps on the body. These are some of the withdrawal symptoms which people face and have been reported. But the good part is that most of the symptoms are mainly physical, and they're very weak in nature. Like if you talk about headaches or insomnia, which this can be overcome with a lot of things, like your strong willpower, or if you could find ways to combat that. Because if somebody is trying to quit smoking, then you have to be prepared. That is, I think, the best thing about a cigarette, as we know, is that it is a very weak drug, so it's not that difficult to quit smoking. But yes, it does require one very strong thing, that is the willpower. There are a lot of prescribed medications as well, or we can have nicotine replacement treatments like NRTs, which involve nicotine gum, lozenges, skin patches. So these things, they contain very tiny amount of nicotine, and they help easing the withdrawal. But as we know that if somebody is trying to quit smoking, then um, having any amount may lead to a relapse. So it is always good to not consume the any kind of product which has nicotine in it. If we look at the timeline of withdrawal, once somebody stops smoking, within 20 to 30 minutes, the blood pressure and the heart rate, they start to get down to the normal. Within 2 3 hours, somebody may have mood swings or drowsiness, and they may crave for more. But yeah, the system starts to flush out the nicotine from the body. Within 8 to 10 hours, the oxygen level in the blood, it becomes normal, and most of the carbon monoxide present in the blood, it is removed. Within 24 hours, a person may experience increase in their coughing, but that is a body's defense mechanism, or to clear out the toxins from the lungs, which are now getting released because of the withdrawal. And the risk of heart disease is that it starts to decrease after 24 hours. Now, third day, it said that the third day is the most crucial day if you somebody is trying to quit smoking, because uh, in 72 hours the nicotine is almost gone from the body, and that is the time when the brain is looking for more from for nicotine, which may activate the reward system, and for the release of dopamine in the body. So if somebody is able to sustain that third day, the cravings, the irritation which has now come up after 3 days, so then if you're done with the 3 day, yeah, the worst is over. So after that, the symptoms, they start to go down. The nerves, they repair themselves. The taste buds, you can start getting the taste. But yes, these are all physiological changes. Like if we talk about the headache, this, it's not a very serious problem. And it is good to avoid any alternate products if you're trying to quit smoking. And if we talk about insomnia, then to combat all these factors, a person who's trying to quit smoking can indulge in the activity, be prepared for these things. You can have your you can do binge watching at the night, or you can do some meditation, go out for a walk, or talk to somebody on phone. And you can have your friends ready who can help you, or the family members, who can help these 3 4 days to for you to take pass on. And you need to curb that craving which is happening. Some people may have some gastrointestinal problems, or have diarrhea or dehydration, or constipation, so they can have a healthy diet and keep your body hydrated. When it comes to depression and anxiety, it can be combated with the involvement of your friends or the family members who can help you pass through this time. And within 10 days, the nicotine is totally out of your body. And then we can say that, yeah, if you have reached those 10 days, then you are done with quitting. Now the body, it stops to crave for nicotine, because I guess in 10 days it has forgotten that. So the worst is over, and after 1 month, the risk of diabetes and heart problems, it is decreased by 1/3. And after 1 year and up to 3 years, the lungs, they fully repair themselves. The arteries, they get cleared of any kind of blockages which was happening. The mucus which has accumulated in the lungs is cleared, and your lungs can breathe freely. And after 10 years, the risk of any kind of cancer is reduced um, to the level of risk which any healthy person can have. So in 10 years, a person who has been addicted to nicotine becomes as normal as any other normal person.